A very good evening to all. Clearly audible and visible, loud and clear. So we are into our part 1 of the must to know series. With the help of MCQs and with the help of images, I will try to revise the core areas, the areas which are very important from the subject of forensic medicine and toxicology for your upcoming NEET PG exams. So before starting the session, a quick briefing about few of the batch courses which have started, and this is an offer which should not be missed. If you plan to take a subscription, you can utilize this. Unlock 20%. You will be able to get 20% discount on any Unacademy subscription. Then you can give this All India mock test to be held on 19th of February at 9 a.m. free for all. Then with every plus subscription, you get access to both live and recorded sessions. You can take the benefits of iconic subscription. And these are the toppers of FMG exams, and these are educator curated test series held from time to time, and subject wise tests are also held just after finishing a particular subject. Now coming to the batch courses, these are your batch courses. Like this is a target next subject wise batch course. Some students were asking now so as to how to go ahead with 2023 next exams. So this is the batch course curated for those students who are going to give their exams next year. Then NEET PG 2022 different sorting has been done in the form of high yield MCQs will be revised in one session of all 19 subjects. Then there will be ultra fast revision courses. Previous year question revision of all 19 subjects will be done in a strategic manner. And for your FMG exams, another batch course live sessions will be there in the form of all 19 subjects will be covered, which has started today itself, that is 2nd of February. And today, after the end of the session, you can join this open house discussion session, which has recently been started on Unacademy app. And you can directly interact with me. You just need to raise your hand. I will be inviting you up, and then you can clarify any of your queries, be it academic, be it personal, whatever. So you can directly interact with me. So this is the first session for me also. So I will also have my learning. You will have your learning, and let us make this open house discussion fruitful. After end of today's session, I've shared the link already in the Telegram group, and in the Learners app, it might be reflecting. The link is reflecting. So this is the first question for today. Let us start with the session. You all can put your answers in the live chat window. Juvenile Justice Board is courts for dealing with juvenile cases, and it is presided by which rank of judge out of the following? A very good evening to all. A very good evening to all. क्या होना चाहिए आंसर? Answer is always first class judicial magistrate. And this first class judicial magistrates, in particularly in your juvenile courts, they are referred to as principal magistrate. Just like first class judicial magistrate in metro cities is referred to as metropolitan magistrate, so in juvenile courts they are called as principal magistrate. And this first class judicial magistrate in metros is referred to as metropolitan magistrate, which you all know. The PM is the same rank of judge, and this is the rank which presides the juvenile courts. Usually the judge should be a female judge. If not available, a male judge can also preside along with 2 female social workers. So this is how the juvenile courts are presided by a judge, and along with the judge 2 female social workers. Then chief judicial magistrate is referred to as chief metropolitan magistrate in metros. What is the unique thing about additional session judge? Is that unique thing which you should always remember? They have got lots of D alphabets, and they have that unique power of death sentencing. The minimum rank of judge having death sentencing power, and yes, they will have life imprisonment power too. The minimum rank of judge having unlimited fine power is your chief judicial magistrate. Okay? All these are questions related to power of judges, a very high yield topic. You get questions from this topic. Second question. Pick the best answer out of the following. A physician can be prosecuted for criminal negligence. Negligence topic is always important for PG exams and also very important for your next pattern exams. So which of the following sections will come into play if the charge is over a physician that he has committed some gross negligence, gross injury has occurred to the patient because of negligence of the doctor? Best answer of this question is, that means you all are unaware of the sections related to criminal negligence. What happens in criminal negligence? Whenever gross injury has occurred to a patient, this simply means, the simple meaning is gross injury or major injury. उससे भी simple है. Gross injury or major injuries has occurred to a patient, or something which is like life threatening to the patient. So if the patient goes to police station, what are the options available to a policeman? The options are available to the policeman in the form of IPC sections, and these are your sections available to the policeman in relation to negligence cases. Now, what is the detail of these sections? Let us do a quick recap. 336 IPC will be applicable in the FIR if the offense is like that the doctor was so negligent or the negligent act was endangering to the life of the patient. It was endangering the life of the patient. Like the doctor was negligently going to use HIV infected needle to another person to take the blood sample from another patient. He was going to use HIV infected needle. So this is, HIV is a dangerous disease. It is dangerous disease to life. So yes, the patient life was in danger. If this is the complaint, the FIR will be lodged under 336. So yes, this is related to negligent cases. Then 337 IPC will be applicable when the patient says that the negligent act has led to simple injuries, legally referred to as hurt. If the patient says that the doctors and the hospital actions were so negligent that grievous hurt has occurred to me. And now you should remember what is hurt and what is grievous hurt. Hurt is defined in 319 IPC, grievous hurt in 320 IPC, which you all know. 304A is applicable when negligent act leads to death of the patient. So it's not that only 304A is related to negligence. All these are 4 IPC sections related to negligent act done by a doctor or hospital. So yes, D will be the correct answer. All of them. Got it? Answer this one. While giving evidence in court, a judge can ask questions to a witness during which part of examination? What do you think? Examination in chief is also called direct examination. Is also called direct examination. Then what happens is cross examination done by the opposite lawyer. Re-examination can be done by the lawyer who has called the witness. What should be the correct answer? The correct answer goes with option D. And these questions asked by judge to a witness, they are called as, the questions asked by judge are called as court questions. And judge is the supreme authority in the courtroom. So they can ask questions to a witness at any stage of examination of a witness. Clear? Now, leading questions are asked during courtroom procedure. Leading questions are normally asked during which part of examination of a witness? Cross examination. This recently was our All India exam question. Yes, leading questions are allowed here. What are leading questions? Questions answerable in yes or no. Do you want to get a good rank in NEET PG exams? Yes. Yes, my lord. So yes, all these questions which are answerable in yes or no. These are leading questions. And another important fact regarding cross examination is there is no time limit. There is no time limit for cross examination, and there is no time limit for another procedure done on the order of a magistrate, and that procedure is exhumation. What is exhumation? Taking out a dead body from the earth. Taking out a dead body from earth. Exhumation is also called disinterment. It is also sometimes called as disinterment. Don't be afraid of after looking at this word in the question, if at all it is asked. Okay. So this is another high yield topic. Recently you got one question from this topic. Answer this one. Onus of proof regarding contribution in contributory negligence case lies on. Onus of proof regarding contribution in contributory negligence case lies on. Regarding contribution, what is contributory negligence? Let us do a quick recap. The doctor was initially negligent and patient also contributed. This is what is contributory negligence. Patient has contributed for his own injuries along with the doctor. So this patient goes to consumer court for compensation, either at district level, state level or national level, depending on the compensation amount. He will go to district commission if his compensation amount is up to 20 lakhs or 1 CR. Now it is 1 CR. A patient will file complaint in state commission level when the compensation amount is more than 1 CR to 10 CR, 10 crores. And if the compensation amount is more than 10 CR, he will directly file the complaint at national level, national commission level. Okay. Now the case in the court will be like this: patient versus doctor. So in a civil negligence case, patient usually goes to consumer courts for compensation, for monetary compensation. So the case runs like this. These are basically quasi-judicial bodies. They have got civil courts power. All these commissions, district commission, state commission and national commission. So normally in civil negligence, what happens? The burden lies on the patient. The patient has to prove the guilt of the doctor. Now here the question is, onus of proof regarding contribution. Who will try to prove that the patient has contributed in negligence? The doctor. Yes, this burden of proof or onus of proof regarding contribution will lie on the doctor. Clear? So that was the question. Answer this one. Recently you have been getting questions from asphyxial death like this. Let us do a quick recap of this particular repeat question. The options have been modulated by me so that we can revise everything. Hello, answer batao. What will be the answer to this one? Pick the best answer. These are your answers. ABCD. You have to answer in this manner. ABCD. Pick the true statements and then pick your alphabetical option. क्या लग रहा है? क्या होना चाहिए? Yes, hypernatremia होना चाहिए. Why? Because what happens in seawater is hemoconcentration. This is a basic thing which you should remember. In seawater, what happens? The water which has come into alveolus has lots of sodium chloride with it. So if I compare RBC compartment with alveolus compartment, alveolus will have a edge, upper edge. So what they will do? They will start attracting water from our red blood cells only. So all the red blood cells, they will be crenated, they will be shrinked. So I can say yes, hemoconcentration will be there. As a result of hemoconcentration, levels of all the electrolytes will be raised. Correct? So this is wrong to say that hyponatremia will occur. And this is a common damage in any type of drowning deaths, wet drowning deaths, where water has entered your alveolus. When water comes into your alveolus, what happens? It damages your type 2 alveolar cells. So yes, damage of surfactant production will be there. So 1, 2, 3, 5, 6 is the correct answer. This is a common thing. Why myocardial anoxia will occur? Because the normal gaseous exchange will be compromised. All these red blood cells, when now they will enter your left atrium through pulmonary veins, they will have very lesser amount of oxygen because the gaseous exchange is already compromised, because the alveolar chambers, they are filled with water. So yes, myocardium will go into anoxic condition. Correct now? So remember this common damage. This is the common damage of wet drowning. Whether the water is fresh or salt, if water is there, these two features will be seen commonly. What happens in fresh water? Now, because the RBCs are rich in potassium ions, and if the water is fresh, what happens is movement of water from alveolus to your red blood cells, so hemodilution occurs. Now I can clearly say that as a result of hemodilution, all the electrolytes will be decreased except potassium. Why? Because RBCs are rich in potassium. So hyperkalemia is a very good finding of your freshwater drowning. But other electrolytes, what will happen? Fall. Answer this one. This one is another area which is very, very important, your identification chapter in particular. And recently questions have been asked from sexual differences with the help of bones brought to forensic department. Pick the correct answer. A female skull was brought by police. It was analyzed to consider this as female skull. Which feature should be present? So let me also mark. Yes, females have got prominent frontal and parietal eminence. So this is true statement. All the parameters in skull bone, they are large and prominent in males except frontal and parietal eminence. Yes, they have a narrow mastoid. Females have got narrow mastoid. Mastoid bone is just behind ears. They have a small smooth glabella, correct? But females have got a round orbit, round chin and round forehead, which we have covered in our classes too. Will they have a prominent cheek? Answer is no. All the parameters are large and prominent in male skull except frontal and parietal eminence. And this is a thing to remember. Females have got round forehead, round chin, as well as round orbits. Yes, 1, 2, 3, 6, 7, 8. C is the correct answer. Similarly, in your pelvis bone, what is that basic line which you should remember? All the parameters in pelvis, they are large and wide in females. Females have to go through the process of delivery. So all the parameters, so that the fetus delivery can be done, all the parameters by nature rule, it is large and wide in females except OSA. What is O there? O for obturator foramen, S for sacroiliac articulation surface, A for size of acetabulum cavity. Obturator foramen, sacroiliac articulation surface and acetabulum is large and wide in male pelvis. So your exception in pelvis is this and your exception in skull bone is this. And remember that basic line. It will help you to solve questions. And remember this too. Females have got round forehead, round chin and round orbit. Answer this one, a recent question. Match the following stages of iron toxicity. Match it. So this is the clear-cut matching. The table itself shows you the matching. Pick the correct answer. This is a recent INI-CT exam question, not to be missed. So acute iron toxicity has got, this is acute iron toxicity stages. Usually happen with small children who consume the tablets which were being consumed by the mother because of the regular menstrual blood loss or due to pregnancy. Females consume iron tablets. So the maximum cases of iron poisoning is usually accidental and the age predilection is small children age group. So stages of acute iron toxicity is divided into stage 1, which is referred to as GIT stage, for first 6 hours. And always remember, in GIT, it acts as a corrosive for GIT. It will lead to GI bleeding. Gastrointestinal bleeding episodes will be there. Then after 6 hours till 1 day, 24 hours is 1 day. It is a recovery stage. The patient might recover if the patient is given desferrioxamine, which is the antidote for your iron toxicity. So yes, patient will recover. But if the patient is not treated well in time, the patient can go in a stage 3, which is metabolic and severe stage, where he can present with severe hypotensive episodes for next 1 to 2 days. And after 2 days, liver will get compromised, will get damage of liver will start, hepatic damage, and that is referred to as stage 4. So this is the clear cut matching. A matches with 1, B matches with 2. So A is the correct answer. What is stage 5? There is one more stage, that is stage 5, which is referred to as delayed stage. So after about 5 days of this corrosive thing happening in our GIT, in our esophagus, stomach and intestines, at about 5 days, macrophages will come because of that intense inflammatory activity, and they will try to heal by inducing fibrosis. So the delayed complication is seen after about 5 days till weeks in the form of strictures throughout your gastrointestinal tract, strictures in GIT. This is referred to as stage 5. So this was a recent exam question, not to be missed. Answer this one. Two friends fought with each other over the issue of a female. One of the male pushed other and kept his feet over chest of other and put pressure over his airways with his hands. Means there was chest compression and there was external compression of airways, means mouth and nose. So the basic thing is, if there is external compression of the chest by a heavy object like a person putting a pressure over chest, so this is referred to as traumatic asphyxia. And compression of the airways by any means. Here hands have been used. You can use pillow too. So this is referred to as smothering. And because this events were utilized to kill a person, so I can say yes, it was a homicidal attempt to kill a person. So it was a combination of homicidal traumatic asphyxia and smothering. And in one word, this is referred to as burking. A goes as the correct answer. What is overlaying? Overlaying is same thing, but the manner in overlaying is accidental, usually seen in newborns. Usually seen in newborns by their parents only. Accidentally, one of the hands of the father was bulky, and one of the hands of the father went over chest of the newborn, and another hand over mouth and airways, mouth and nose. So yes, the newborn can get killed, and this mechanism in one word is referred to as overlaying. What is burking and details you all must be knowing. So burking is a combination of homicidal, traumatic asphyxia and smothering. Next time if they give you the same question, and the moment they add the word that another male was accidentally killed, the moment you see that word, your answer will change to overlaying. So read the lines carefully. Burking, please explain in Hindi. चलो ओके वंदना. तो ट्रॉमेटिक एस्फिक्सिया क्या होता है कि आपके चेस्ट के को कंप्रेस कर दे. कैसे कंप्रेस कर सकते हैं? If someone sits over the chest, if someone puts pressure over the chest, if there is fall of building over chest. Yes, traumatic asphyxia can occur. Traumatic asphyxia is defined as external compression of the chest. What is smothering? Compression of mouth and nose. And a combination of these two events, if the manner is homicidal, in one word we say the mechanism is burking. If the manner is accidental, in one word we say the mechanism is overlaying. What is burking? There were two friends, Burke and Hare. They used to call poor people to their house that we will give you free food and alcohol, please come to our house. And when the person used to go in a intoxication phase, this Burke used to sit over the chest of the person and he used to smother the person. Smothering means mouth and nose को compress कर देना, close कर देना. So, and it was an attempt to kill the person because they used to sell the dead bodies to anatomy department of Edinburgh Medical College. So that is why we got this famous name of burking, in the name of burking. अब हो गया, समझ आ गया दुबे जी? लेट अस मूव अहेड। समझ आना चाहिए। A 50-year-old male suddenly stopped alcohol consumption for 3 days. Another topic तो हर साल पूछा जाता है, every year it is asked, and presents in hospital with agitation, altered sensorium, paranoid delusions, and hallucinations. Most likely diagnosis is, if someone is saying Wernicke's encephalopathy, मतलब आपने क्वेश्चन जल्दी में पढ़ लिया. Questions should be read, the line should be read very carefully, very patiently. The moment you see sudden stoppage of alcohol, and at about 3 days, this symptom presentation in the patient, the symptom presentation of excitability, your diagnosis becomes delirium tremens without any second doubt. Okay? Without any second doubt. So this is a frequently asked question. So don't miss this topic. Everything should be covered about delirium tremens deeply. अब इसका आंसर बताओ. Now, if I label this as image number 1, and I ask you, what are these injuries? What are these injuries? Incised wound, lacerated wound, incised looking lacerated wound, or lacerated looking incised. 4 options: incised wound, lacerated wound, incised looking lacerated wound, or lacerated looking incised wound. These are your 4 options. So this is how your split lacerations, also called as incised looking lacerated wounds, they appear. You can appreciate the abraded margins. Nicely can be appreciated over this image. And you can appreciate the abraded margins. So if I use a knife over forehead, if I use a sharp edge weapon over forehead, what happens is, if I use this force, if I use a blunt force, but the margins are sharp, so what happens is, I will get an incised wound because the weapon was sharp. So this is the image showing you a clear-cut picture of incised wounds because the margins are clean-cut without any abrasions. But if I use a rod-like weapon and I hit overhead and the impact was large and it was blunt, so there are chances that in this head area, this is the scalp, suppose outermost, and suppose this is your skull bone. Green color is your skull bone. So if I make an impact over a scalp, skull bone is going to give a resistance. So all the soft tissues of this scalp layers, they will be sandwiched between the impacting surface of the weapon and the underlying skull bone. Why? Because the skull bone is just beneath the skin. So this is how your incised looking lacerated wounds are produced. The mechanism also has been asked in your INI CT exam. The correct answer was the soft tissues getting sandwiched between the weapon and the underlying bone. So yes, that is the mechanism for your incised looking lacerated wound, also called as split lacerations. How do you identify them? They will give appearance of an incised wound. But if you watch closely, you will appreciate the abraded margins. Clear? So remember the mechanism. Remember the mechanism. And right now it's time for our open house session. So do join this session. We will have a one-to-one interaction, audio interaction. You can directly clarify your doubts. You can talk to me. Ready for that open house session? I have shared the link already. It might be reflecting in your learners app. It must be reflecting in your learners app. So time to end this session and let us start with our open house session. Let us give it a trial.